The treatment of choice for a mandibular fracture between the incisors. Answer A. For a fracture in the mandibular incisor area, Risdon wiring is often the treatment of choice. This technique involves placing a wire around the teeth and through the soft tissue to maintain the fracture in the correct position. It allows for early mobilization and reduces the risk of complications like malocclusion. What is the type of fracture that occurs in the tooth-bearing segment of the mandible? Answer C. A compound fracture occurs in the tooth-bearing segment of the mandible. This is characterized by an external wound that connects with the bone fracture, affecting the skin, mucosa, or periodontal membrane. The fracture line typically extends through the alveolus, and the proximity to the teeth can complicate the treatment process. In which age group is a Greenstick fracture most commonly found? Answer C. Greenstick fractures are most common in children. These fractures occur when one side of the bone breaks and the other side bends, resembling a green stick that has been partially snapped but not completely broken. This pattern is typical in children's bones due to their greater flexibility. In a proximal segment of a mandibular angle fracture, what direction is the displacement typically found? Answer A. The proximal segment of the mandibular angle fracture is usually displaced anteriorly and superiorly. This type of displacement can cause loss of the angle's prominence upon palpation and may be accompanied by symptoms like an elongated face due to the rotation of the fragment. The main muscles that affect the displacement of the proximal segment are the masseter and medial pterygoid muscles, which are the strongest muscles that elevate the mandible. These muscles act to pull the proximal segment upwards and towards the front. Additionally, the lateral pterygoid muscle can contribute to the anterior displacement by pulling the segment forwards. Which type of mandibular fracture is likely to cause lower lip paresthesia? Answer A. A body fracture of the mandible is most likely to result in lower lip paresthesia. The fracture may involve or damage the mental nerve, which is responsible for the sensation in the lower lip and chin area, causing the sensation change. What condition is eburnation typically indicative of? Answer B. Eburnation is most commonly seen in cases of non-union of fractures. It is a process where the subcondylar bone changes to an ivory-like surface due to friction within the joint space. This occurs when a fracture fails to heal properly and can be a complication of improper immobilization or poor bone quality. Which method of fixation typically results in primary healing of a mandibular fracture? Answer B. The use of compression plates is associated with primary healing in mandibular fractures. These plates provide stability and compression to the fractured bone, minimizing movement and facilitating the healing process. Rigid internal fixation with compression plates is a common surgical approach for treating mandibular fractures. How long should a fractured mandible be immobilized after closed reduction and wire osteosynthesis? Answer B. This period allows for the fracture to heal adequately and minimizes the risk of complications such as malunion or non-union. How should a fracture of the mandible in the canine region be managed in a 6-year-old child? Answer D. For a 6-year-old child with a mandible fracture in the canine region, cap splint fixation is commonly recommended. This involves placing a prefabricated acrylic splint over the involved teeth to maintain their position and stabilize the fracture. The splint is designed to cover the entire crown of the tooth and is secured with composite resin or wire. What direction does the condyle typically move in cases of subcondylar fracture? Answer A. In subcondylar fractures, the condyle often moves in the anterior lateral direction. This occurs because the strong medial pterygoid muscle pulls the bone segment forward and outward. The resulting displacement can affect the patient's ability to open their mouth and may require Careful management to ensure proper alignment and healing.